What is the treatment depending on the stage? As for E1, which is subclinical endometritis 1, we can use hormonal therapy alone, and it usually helps. If that does not help, it is advisable to introduce substances into the uterus, not necessarily antibiotics, but certainly antiseptics. We now have many lavage solutions that are either herbal-based or based on colloidal silver, so we don't have to administer antibiotics. For E2 and E3, it is advisable to administer antibiotics into the uterus, preferably under slight pressure, or in larger volumes so that the antibiotic fills most of the uterine cavity. Sometimes, if systemic symptoms are present, anti-inflammatory drugs and systemic antibiotics are also required. In severe pyometra, systemic antibiotics are typically used, along with drugs that stimulate uterine contractions and promote the expulsion of pus. We must also prevent toxemia, the entry of toxins into the bloodstream. If clinical signs indicate intoxication, intravenous fluids should be administered to help flush toxins from the blood, which means using fluid therapy. We may also encounter abnormal structures in the uterus. One common example is a uterine abscess. When does it form? It can occur during calving, even during a normal delivery, if the calf injures the uterine wall with its hoof, causing a tear that later scars and forms an abscess. It can also happen that when we assist, we damage the endometrium or the uterine wall, which also leads to an abscess. Abscesses can also result from administering, for example, intrauterine antibiotics. Because the uterine wall can be very fragile in some places, we might slightly damage it with a catheter and cause an abscess to form. If abscesses are located within the uterine lumen and do not decrease over time postpartum, the prognosis is rather poor. However, we often have cases of abscesses that do not bulge into the uterine lumen, but are located within the uterine wall, in the muscular layer, and in these cases, the prognosis is very good. It must be remembered, however, that if this abscess does not shrink, the risk is that if we breed such a cow, the stretching of the uterus as the calf grows, or even just before calving, could lead to a uterine rupture. This is very dangerous, so it is important to consider whether such an animal should be used for reproduction, even if insemination might be successful. Remember that abscesses may also result from uterine inflammation. Bacteria present in the uterus can damage the uterine wall and lead to abscess formation. In summary, we must do everything to ensure that by 50 days postpartum, the uterus is ready to receive another embryo. Therefore, proper preparation is essential. If we know that uterine problems are common after calving, it is advisable to examine the animal as early as 7 to 10 days postpartum. If clinical signs appear earlier, examination should be performed sooner. Otherwise, checking at 10 to 14 days is good practice to assess the situation and initiate treatment if necessary. The first line of treatment is usually hormonal therapy, typically with natural prostaglandins, administered according to a specific protocol. This stimulates uterine contractions and helps expel its contents, often eliminating the need for further treatment. However, if inflammation persists at the follow-up examination, which should take place 1 to 2 weeks after the initial treatment, antibiotic therapy must be initiated. This is usually a local treatment, involving the use of a lavage. Of course, care must be taken to avoid damaging either the cervix or the uterine wall during administration. We must also remember one more thing. If we have a herd where more than 10% of the animals develop uterine inflammations after calving, we need to investigate the underlying cause. The first thing that should raise a red flag and draw our attention is nutrition. Specifically, nutrition during the dry period, and especially in the second stage, the 3 weeks leading up to calving. Furthermore, if we face significant uterine issues postpartum, we must remember that it will be difficult to inseminate most animals by 60 to 65 days after calving, which is our target. This will result in an increased average days in milk and negatively impact other reproductive indicators, such as the pregnancy rate. The better we prepare the uterus after calving, the higher the probability that our cows will conceive successfully.